Well, welcome everyone. We're delighted to have everyone today for the fourth of our Diversity in Maritime Lunch and Learn roundtables as part of London International Shipping Week. My name is Chrissie Clarke. I'm the Head of Diversity and Operations for Maritime UK and Secretary to the Maritime Skills Commission. We started our Mental Health in Maritime, creating a Culture of Care webinar series at the start of the year. And today marks a very important topic around breaking down stigma. We're joined by a fabulous panel, and the session today will be chaired by Stuart Hollard, who is the chair of our Mental Health in Maritime network. A few bits of housekeeping. For everyone in our virtual audience, we're delighted you could join us today. There will be an opportunity for Q&As. Please do use the chat function, and we will come to that later in the session. We also want to make sure that everyone in our virtual audience feels safe and comfortable. So at any point, if you do have any concerns about the topics, please do feel free to private message me under Maritime UK in the chat function. I'm now going to hand over to our chair of the session, Stuart Hollard. Thank you.
Thank you, Chrissie, for that introduction. First of all, welcome everybody to this session, all focusing on breaking the stigma. As Chrissie has mentioned, we've got some great panelists and speakers for you on the call. I'll just do a quick rundown of who they are. So we have Sandra Welch, the CEO for Seafarers Hospital Society, Samantha Morris, who is a seafarer and mental health advocate. We have Stephanie McLay, who is a senior human factors consultant in the marine and offshore sector. And we have Mark O'Neill, who is president of Columbia Shipmanagement and InterManager. Welcome to the panel, and thank you very much for your time. Mental health is really one of the key aspects of the Diversity in Maritime program that we have. It was born just over 15 months ago, and we have made strides to try and connect people and make sure that we are having that active conversation all around mental health. Those that know me really understand why I'm why I promote mental health. That's because one of my family members committed the act of suicide because they had depression and anxiety and everything else. If he had spoken up at the right time, we could have had a very, very different conversation today, and we could have had him on the call actively engaging on mental health and everything else. Unfortunately, that's not the case. This is why breaking the stigma and breaking that silence is absolutely critical to making mental health in the workplace and within the maritime sector so key. Lastly, what we'd like to do is also thank Lloyd's Register for sponsoring this event for us today. Chrissie, I believe you've got a video from the sponsor that you need to play. Thank you.
Hello and welcome to this London International Shipping Week event on mental health in maritime, organised by Maritime UK, titled Creating a Culture of Care. My name is Philippa Charlton and I'm the Chief Marketing Officer at Lloyd's Register, and my organisation is very proud to be sponsoring this event, which focuses on breaking down stigma. So before we meet our panel, I want to consider stigma a little more closely. To break down the stigma around mental health, it's important that we use opportunities like this to change perceptions. We need to say this loudly and clearly. Getting help with mental health should not carry any stigma. Getting help should be the norm. Getting help shows strength. And getting help is about finding the tools to enable coping mechanisms to work. Unfortunately, that message isn't reaching everyone. This comes at a time when the pressure on many working in maritime, particularly our seafarers, has never been greater. Many in the industry work tirelessly to keep global supply chains open, especially as the COVID-19 pandemic continues. this past 18 months have highlighted the unique position of many seafarers on extended contracts who've been unable to return home to loved ones due to the crew change crisis. In June this year, the International Labour Organization estimated there were still 200,000 seafarers unable to return home. Lloyd's Register is proud to be a signatory of the Neptune Declaration, helping to take steps to resolve this. Seafarers continue to go beyond the call of duty, showing resilience despite continuing difficulties with port access, repatriation, crew changes, and most recently, access to health provisions and vaccinations. For many, this dedication has come at a personal cost to both their health and overall well-being. Last year, Lloyd's Register, together with the Mission to Seafarers and the UK Chamber of Shipping, conducted an industry-wide survey on the impact of the pandemic on the maritime workforce. The research found that 62% of seafarers felt their health and safety was not being balanced appropriately with operational demands. Just over half of seafarers felt they were not being actively helped to manage stress and fatigue during the pandemic. And most worryingly, crews felt that they were undervalued despite providing essential services. Only 8% of respondents strongly agreed with the statement, "I feel valued in my role." As well as the personal cost, there is the economic impact in terms of poor provision of mental health support at an organisational level. A recent study led by the World Health Organization estimated that depression and anxiety cost the global economy $1 trillion each year in lost productivity. Mental health concerns at worst cost the UK economy £45 billion in 2019, according to Deloitte. The personal cost to those facing mental health and well-being challenges are much more difficult to quantify, though they can be devastating for an individual and for those around them. It's not always easy to recognise and support someone struggling with challenges such as anxiety, stress, fatigue and depression, nor to help them find a balance in the emotional chaos that they may feel. And sometimes those efforts fail. According to the International Seafarers Wellbeing Association, the number of reported suicides and instances of seafarers calling the helpline about suicidal thoughts have roughly doubled from around 12 in a normal year to 25 since March 2020. Mental health and well-being has an impact on safety, not just to the individual, but to their colleagues too. Maritime is, of course, a safety-critical industry in which seafarers play an integral role in maintaining the safety of ship operations. A survey of marine industry professionals by Lloyd's Register's Safety Tech Accelerator found 41% of risk on a vessel is managed by the crew. And we all know how our outlook and our state of mind can affect our ability to focus on our work and impact the decision-making process. So what can we do as an industry? Well, we need to create an environment where everyone in our industry feels empowered to talk about mental health and well-being without fear and without stigma. The first step in creating the conditions where we can talk openly about our mental health and well-being is getting our industry talking, to raise awareness that health is more than physical and covers a wide spectrum. We can help people find a voice to seek support and to help those around them. And given the critical nature of the seafarer role, it is vital that we as an industry understand well-being challenges and how we can offer better support. Currently, Lloyd's Register Foundation is collaborating with the Seafarers Hospital Society and Yale University to research the effectiveness of initiatives by the maritime industry to keep seafarers healthy and safe, which will inform best practice with the initial findings due soon. Projects like this and today's event have a vital role in spreading understanding and determining the best ways of supporting those in our industry. Maritime leaders must make it clear that mental health issues should not carry any stigma. We must say it publicly and reinforce the message. The good news is that a little goes a long way. Small-scale solutions can have a big impact on well-being. So thank you for listening to our panel today and for being part of a community that's making a positive change in the lives of maritime workers, both today and tomorrow.
Well, I think everybody can see and hear that we are trying to make a difference within this sector. We're trying to make everybody empowered. We're trying to break that stigma of mental health issues. We're trying to get the industry talking, and that's what we're here today for. We're trying to find every single one of us that is connected to the maritime sector to have that voice. And where that voice is heard, provide that support to them. So, panelists, I pose these two questions to you. Why is creating a culture of care important to the maritime sector? What is the importance of visible leaders in breaking down stigma? I'm going to come to Samantha first to introduce yourself and answer those two questions. Thank you.
Hi, I'm Samantha Morris, and I'm an experienced seafarer with over 10 years working at sea, equally split between the cruise ship and the yachting industry. Why is creating a culture of care important for the maritime sector? As seafarers, we spend long periods of time in an intimate environment where we both work and live together, away from our families and friends and society. It's important that our leaders promote a culture of care so that we can feel safe at sea and be happy on our home away from home. Working in a toxic environment can be detrimental to both our mental and physical health, and which in turn can lead to fatigue, burnout, or more serious fatalities. The importance of visible leaders breaking down the stigma around mental health is that it can act as a prevention for suicide. With the right help, it is possible to recover from mental illness and to live a comfortable and happy life. I recently qualified as a mental health first aider, which has allowed me not only to identify the mental struggles within myself, but also to observe them within my fellow crew members around me. Being a mental health first aider enables me to approach the crew member, to give them my time and a space to actively listen and to discuss what they wish to say, and to point them in the right direction to seek professional help if required. As a leader, I can talk openly and honestly about my own experience over the last years to encourage other crew to be able to have the courage to talk about their own without judgment. Thank you.
Samantha, thank you very much. Sandra, I'm coming to you next.
Thank you very much, Stu. So I very much, so I'm from the Seafarers Hospital Society. We're a charity dedicated to meeting health and welfare needs of seafarers. I personally have been involved in seafarer health and wellbeing programs now for almost 8 years. It seems a long time actually when I think about it, and I think we've made big strides really in terms of thinking about seafarer mental health. So on this panel, I very much wear a seafarer's welfare and wellbeing hat, and my perspective is that it's really important to create a culture of care, not only because it's the right thing to do, but if you're looking at it from a business perspective, it's very much a good business plan too. A culture of care really is more about just caring for your crew. It's very much a holistic approach, which goes beyond safety and health and relates to the whole package of benefits and support offered to seafarers and their families. Unfortunately, it's not something that you can institute overnight. It takes planning and most of all, buy-in and follow through by your corporate leadership, and it needs to be spread right across an organization. You know, the old saying goes, you need to put your money where your mouth is, and I think it's very much this case. You know, a culture of care in an organization, if your crew see that you're making a tangible investment in building a culture of care, so that's investing in programs, investing in support, investing in training, they will know that you are serious about this. And this is particularly important when you're trying to break down stigmas, you know, and to care for crew. So it's important that you have leaders who kind of can be very visible in helping to break down these things. Do you know that 9 out of 10 people with mental health problems say that stigmas and discrimination can make difficulties worse and actually make it even harder for them to recover, and sometimes even trap them in a cycle of illness. So mental health problems are something that is really common to people in the UK and around the world. So visible leaders will really be about addressing these things, talking openly about mental health issues that people face, to educate themselves and others so that they can respond to misconceptions and negative comments. And something that we need to be really conscious about, and I hear it time and time again, is the language, to remind people that words really matter. To encourage people, and I think we picked up on that in the video that we saw, about having equality between physical and mental illnesses, to draw comparisons to how we would treat somebody, for example, who has cancer or diabetes and other common illnesses, with how we should be treating people with mental health problems. It's about also being open and honest, and to try and normalize mental health, just as we would other healthcare issues that people might present with. And I think really for companies, it needs to be about a commitment to leading a behaviourally healthy environment, and to mention a company's culture of care every time that they speak. Thanks very much.
Sandra, thank you. Stephanie.
Hi Stuart, and thank you for inviting me to the panel. I come to this really today with a few hats on really. But I'm a senior human factors consultant for Lloyd's Register. We do a lot of work on board ships, meeting people in the front line. Also, I'm the chair for the IMREST Special Interest Group for Wellbeing of Seafarers. And I've had a passion in this area for many, many years. I started my career actually as a work psychologist in a vocational rehabilitation role. So working with people who were off work with neurological conditions and acquired brain injury and other health conditions, and really taking those steps to get back into employment or potentially start new roles in different environments. So I think my knowledge around stigma and the impact on people and their general well-being and mental health started well over 10 years ago, really looking at it from not only just individuals, but from very much how workplaces dealt with it, different industries dealt with it, and the differences between a lot of those industries. I've had experience with Lloyd's Register for about 3.5 years within the maritime and offshore industry. And again, it's a very similar story. So from my perspective, I think it's so important to nurture and create a culture of care, to make sure that there is more promotion of holistic support avenues, and opening up those channels where people have not just the official lines of who they can go to about things, but also building those relationships with colleagues, feeling more supported by their peers and more open to kind of having those types of conversations. And I know on a personal level, having team members who will just check in with you from time to time makes a massive difference, even if there's not a huge amount going on. So in terms of visible leadership as well, it's absolutely paramount because change is very much driven from the top down. So if we've got leaders who really believe in having this culture of care, having more open communications, challenging stigma and promoting increased well-being across the board, then we will have a more successful sort of journey, I think, as an industry. So events like this will start the conversation. I think we will see that working environments hopefully will begin to show that there are measures which break down some of that stigma and increase the awareness, but also an increase in the use of positive terminology. And with visible leadership, they can very much drive this with the language that they use, like Sandra was saying, to give this message that it's okay to not necessarily be okay. Thank you.
Thank you, Stephanie. Lastly, but no means least, Mark.
Yes, thank you, Stuart, and sorry to hear about your personal tragedy as well. Look, I think culture of care and an effective, proactive, preemptive human resource management in our industry is critical to any organization going forward. And I think the effect of COVID on this concept, on this issue, has been to act as a real catalyst and show us all the importance of care, the need for mental health, the need for the wider human resource management. I think sometimes, one can look at the symptoms and not at the causes. And one thing I like about Chinese medicine is that one doesn't just address the symptoms, doesn't just address the mental health issues when they arise, but actually goes back and looks at the causes and tries to get away from the causes. If we have effective human resource management in our industry, onboard vessels and ashore, and let's not forget this is as important to our colleagues ashore than many of these issues, many of the care issues of our employees and our people, and many of the mental health issues will be avoided. COVID has re-emphasized the importance of people to us all in our personal lives and in our professional lives. And I think people are more and more, and should more and more, be seen as assets to our organizations, assets on our balance sheets, as opposed to expenses on a vessel's OPEX report or on my profit and loss account. I think people need support. People need to be taught to be resilient. People need to be taught to recognize failings or weaknesses in colleagues who need help, and people need to be taught how to help, if only in a first aid type manner, but they certainly need to be able to recognize the symptoms and recognize the signs. And last but not least, people need to realize that there is real courage. Sometimes the bravest thing one can do is ask for help, and it's certainly not a weakness. I think it's also massively important that leaders in our industry, in whatever parts of our industry, really lead by example, but not just lead by example to break through this stigma, but really understand what this is all about. I must say that I would probably be challenged in understanding this if I hadn't also benefited from mental health support in my time. In my previous life, I was an army officer. And when I came through the Gulf War, there is no doubt that I needed help in dealing with various post-traumatic stress disorders that I had experienced in that time as I started out on my legal career. So I got it then, and I get it now. And post-traumatic stress disorder, or however you want to label it, is manifest both amongst our people on board our vessels and ashore in dealing with the stresses that this COVID pandemic have brought up. We started this process within Colombia before COVID struck us. My partner is a psychiatrist, and I was hit quite badly by a suicide that we had on board one of our vessels, a suicide that could so easily have been avoided if we had had the necessary support structures in place. And I don't just mean the friendly arm around the shoulder or the shoulder to cry on, but professional support. And it's really, really important that one combines professional psychiatric care with the shoulder to cry on and with the pastoral religious care, all working in tandem and in partnership. So our mental health support started with that suicide, whereby we resolved to go to an organization, Mental Health Support Solutions, to provide that support. And I have to say, it is massively appreciated by staff ashore and on board our vessels, not because they use this helpline or the courses that are offered, but because it is a support there, it is a crutch there if at any time they need it. And that's so important, and that's sometimes missed. It's not just the ability to use it, but the knowledge that that support is in place if needed. But actually, you can break down these mental health and care issues very, very simply. It is it doesn't always have to be complicated. It is emphasizing the importance of rest, the importance of relaxation, the importance of exchange between colleagues, whether they're on board the vessel or on board the vessels or ashore, the importance of fitness, the importance of drinking water, the importance of a healthy diet. All of this holistic approach that was mentioned by Sandra is so vitally important. You can't just take a symptom and deal with that symptom. You have to deal with the whole, and you have to do this in a complete holistic human resource management approach, of which mental health and caring is so vital. And without the buy-in from the people at the top down, and without the buy-in from all of the people at the bottom up, it simply won't work. But I think we are getting there as an industry, and I think you know, we've all seen and experienced tragedies despite our best efforts during this COVID that we try to minimize and spur us on to ever greater efforts in this field.
Mark, thank you very much. As you can tell, we do have a panel here that is very passionate, very understanding of the situation, and have their own views. I'm going to ask the panel to have a bit more of an open dialogue as we go forward, to explore what support we can demonstrate to the sector on what we are doing across the industry to break down that stigma. So some of the panelists have already identified what they're doing within their own, but if we can actually draw out some of these good examples, and I'll ask the panel to cut across each other as well, just to interject where they might have something to say on that specific issue. I'm going to ask Mark to lead the points off and take any one of your opening statements or comments from what you just advised us and spoken about, and actually sort of draw the rest of the panelists in. What I might suggest, Mark, if I may, shall we start with that holistic support? Mm-hmm. Because that's really key, as Sandra has mentioned and Stephanie has mentioned. If we kick off with that one, where's the good examples, and how do you think that helps break down the stigma?
Yeah, we started off probably about 4 years ago with the launch of our I Care philosophy and our I Care campaign, and this was a broad approach ashore and on board our vessels, whereby we required an absolute commitment from our colleagues to our core values, and really understanding our core values and trying to identify their own core values with our corporate core values, and requiring our colleagues to consider this whole I Care philosophy throughout the day. So from the moment they switch on their computers, in fact, they cannot switch on their computers without confirming the I Care principles, to everything they do. Every meeting that is conducted must have an I Care element to it. And what does I Care mean? It means caring about the core values. It means caring about one's colleagues. It means caring about one's clients and one's service contractors as well, because it is the whole holistic environment that we find ourselves in that is important. So I Care as a philosophy was hugely supported throughout the organization, and this feeds into staff appraisals and their performance and their career aspirations. Someone who doesn't care doesn't have a place in Columbia. It's as simple and as straightforward as that. And we have had fantastic support from on board our vessels and within the offices, because for the first time, crew feel identified with, they feel seen, they feel cared about, and they feel communicated with. Because if we care about our crews, then I should be calling up vessels on a regular basis, talking to the master, talking to individual crew members. I should open my WhatsApp and my mobile phone number to each of the crew members, which I do. I get many calls and many WhatsApp messages from individual crew members who think that the CEO of an organization should care enough to receive direct communication and deal with that, which is what we do. So morale on board, despite COVID, and all of the pressures and strains, morale on board has never been higher on board our vessels over the last 2 to 3 years throughout the whole COVID pandemic. We looked at nutrition. We got the best caterers on board to tailor nutrition to the individual crew members' nationalities. There is no point feeding our Filipino crew members with burgers and chips. Why would we possibly want to do that? They should have fresh produce, and each crew should have tailored menus according to their personal likes and dislikes, but fresh produce, so they're as fit and as healthy as they can be. We re-equipped all of the gyms on board our vessels with modern equipment so they're able to keep fit and healthy, and we introduced campaigns and ongoing fitness campaigns and challenges and prizes to incentivize people to get there. We started off an investment in life insurance for our crew, because crew had been invisible. No one thought what happens when one of our crew members, God forbid, dies, and how their families are provided for, because they didn't have life insurance. Now they have affordable life insurance and an investment plan when they come through it. And last but not least, we were the first company to bring in a 24/7 helpline and ongoing courses on mental health and mental well-being and mental first aid. So it's been a huge effort, but as a result, the company has grown hugely as an organization, and we can all feel massively proud about what we have done, and will achieve more as a result, because there's no doubt about it, the closer one brings the team, the better the team performs, and the better the team identifies with the whole. And that's exactly what has happened. So all of the time, effort and money spent on this has brought disproportional rewards back to us, both as individuals and as an organization.
Okay. Sandra, do you have anything to follow up with that from Mark?
Yeah, absolutely. Thanks, Mark. Some excellent things that you're obviously doing within your organisation. And one of the things that I found has worked across a lot of organisations is the fact that they've had 24/7 online support, and it's a confidential support for seafarers, so that at any time that they're feeling pressurised, that they're able to speak to somebody. And very often that support line isn't used hugely, but actually knowing that it's there for them and when they can access it when they need it most is of vital importance for crews. So obviously something that works really well within Mark's organisation. The other thing that I found within companies that works really well is having peer support for the crew, because often somebody who has mental health issues themselves will feel some kind of comfort knowing that there are people within the crew who themselves have experienced this, and so almost having like mental health champions that people can go to and who will talk openly about issues they've faced. And actually it goes a long way to normalizing this process where people with mental health issues aren't kind of avoided or have problems with. It's seen as just a health problem that can be dealt with. And so I think it's very important for companies to be looking at putting these things in. Things like nutrition, when we've done some research, we've seen that nutrition plays a huge part in the kind of morale of crew, but also in the general kind of culture of care. I was aware when I was working with a previous organisation on crew welfare that it was the thing that could make or break the morale of the crew. If the food was bad, the crew was not happy. And making sure that food is culturally appropriate for people is very, very important. Some kind of crew issues that we dealt with were very much about people not providing culturally appropriate food for people as well. So I think there's a lot still to be done, but I think COVID has made us think more clearly about getting the basics right, making sure that we tick all those boxes properly. And it's not just a tick box exercise, but actually it's something that is carried across the organization. And as Mark said, it goes from the top down and from the bottom up as well. So that's all from me. Thank you.
Stephanie, have you got anything to add on the holistic support?
Yeah, I think holistic by nature is really taking into account inclusivity and diversity. And really what we have is a very unique position within the maritime industry, where there's a lot of national cultures, there's a lot of different perspectives on what's needed. I think the other thing is we need to consider very closely what mental health and other terminology means to different cultures and what approaches can be taken to really benefit all of them. So it's not a one-size-fits-all solution. And I think where we're seeing some real successes is by actually going out and speaking to seafarers and saying, you know, what works well for you? What makes you happier? You know, what type of support do you have in these situations? And being able to then share that knowledge and information to say it's more than just raising general awareness. It's also about sort of considering all of the different resources, all of the different organizations we have. I think actually when we're looking at stigma and the support services, the industry is very lucky. It's flooded with support options, but it's really getting through which ones and how you access them and what's appropriate for the different organizations, different areas of the world, and the mix of people that they have. So I think, yeah, that's probably all from me on that at the moment, but just a few things for us to think about.
Okay, thank you. So far, the three panelists have really kind of said leadership, engaging with the people on the ground as well is absolutely essential for making the holistic approach to having an open conversation to mental health issues. And you have to consider everything that surrounds it as well. It's not just about putting in place a program, it's actually thinking about how that individual sits within that ship or on the shore side to make them work better, feel better, and everything else. Sam, just coming to you, peer support, morale on vessels and that side of things, how's that dealt with on the coalface side of things?
I mean, sometimes crew, they don't feel that they've got anyone that they can turn to, that they can approach. Maybe sometimes supervisors seems a bit too scary, like going up the chain to report anything, to say anything to them. Maybe they think it's a little bit too informal, too formal.
So what's the holistic support and approach that you would like to see on some of the vessels that you've been on?
Yeah, to talk about promoting more of fitness and how important it is to take that time out. We're all busy on board dealing with the operations on board, but you must take the time out for yourself and to encourage your colleagues to do the same. As the other panelists were saying with regards to food, food is a big topic that us seafarers we talk about on board. As soon as we've had breakfast, we'll be asking the chef what is served for lunch or dinner. So it's really important, I think, that if you get a good input, so if you feed the crew with healthy food and good nutrition, that you're going to get a really great output for the crew, and they'll be able to, I think that the crew are a main part of any vessel, and that if you look after the crew, kind of like say you turn the triangle on the head, if you look after the crew first, then we'll look after the guests on board or the operations on board to run more smoothly. Another point that nobody raised was, I think that like the internet on board any vessels, it's really important for the crew to be able to still contact their families and friends who are they're home away from home whilst they're busy at work, to still have that connection, the point of focus of the reasons why they're at sea earning those high salaries and spending larger times at sea, but still have a point of focus at home.
Okay, so that brings us nicely into one of the questions that's been asked by the participants. On the vessel, you've got an internet, you've got access to communications and everything else. Eva has asked, do you think e-health and e-consultancy can help seafarers? Bearing in mind, I know that you're in the middle of a shipping channel and potentially difficult to get communications in some cases. Sam, do you want to start that one off, and then we'll go to Mark straight after?
Yeah, obviously, if we're in certain shipping places where there's not much internet coverage or telephone access to, then it makes it difficult to be able to keep that ongoing flow of conversation. I think going forward, it'd be easier if we apply a position on board the vessels where there's somebody always there for the crew to be able to seek and talk to. That's a pure role delegated to being there for the welfare of the crew. Okay,
Mark.
Yeah, I think, you know, that the e-health and e-wellbeing is part of our lives now, isn't it? My son had tonsillitis yesterday here in the UK, and we phoned up National Health, or we went through to the National Health Service via internet and got a prescription for antibiotics. That seems to be the way of the world, and it can be very effective. We have apps on board our vessels now being trialed, happiness indicators. It sounds puerile and simplistic, but actually if you have a crew of 20 and 15 of those show sad faces, you've got a problem on board that vessel, and that problem can manifest itself in a number of different ways. There could be a crew feeling abandoned or not identified with. You could be bullying, harassment. It could be lack of sleep. It could be whatever. But it rings bells that it needs investigating. So happiness indicators through apps and well-being, if you like, is a very useful tool. Equally, we have Doctor in the Pocket, which it also is an app that enables us to analyze health in a more detailed way, but you still need that connection with doctors ashore. So we've had a number of instances, particularly with COVID, where we've had very critical situations with crew being ill prior to the vessels coming into port, and that there is no substitute then for doctors' advice on call. And for that you need connectivity, and for that you need Wi-Fi and sufficient bandwidth, etc. So you know, massive issues dealing with the connectivity, e-health, e-wellbeing. But I do add too a note of caution that our initial knee-jerk reaction to provide all our crew with free and unlimited Wi-Fi on board the vessel at the start of COVID, which was for all the right reasons, so they didn't feel isolated, does have a sting in its tail. If crew go back to their bunks immediately after eating their healthy meals or working out in their newly equipped gyms and spend the entire night communicating with family and worrying about what's going on there and not getting the necessary rest, then that will have an unintended consequence for their performance and their concentrations and their mental health well-being on board the vessel. So yes, communication is great, but it needs to be controlled in a professional way, and free and unlimited Wi-Fi during rest periods, but ensuring that rest is nonetheless obtained is perhaps the modern way going forward. But a lot of issues around this.
Okay. Sandra, do you have anything to add from your background?
Yeah, I'm very much about the fact that you need to have a balance, and what Mark was saying is absolutely correct. You know, we because of COVID, we are far more used to dealing with kind of e-learning and e-assistance. But I think it's all about the balance. So, as part of our mental health provision for seafarers, we provide access to an online platform called Together All. And this is a really good example of an e-support as well as a kind of person support. So there are resources through Together that people can access. They can go onto a wall and talk to other people and talk about the issues that they're having. So it provides them with a level of anonymity and a level of confidentiality, but it's also monitored by clinicians, so that if clinicians spot that there's an issue, they can actually then refer that person to a face-to-face counsellor or for face-to-face counselling. So it's really important that you have that blend, if you like, of both those things. So there will always, and I think now, what I'm not in favour of is just saying to people, there's an e-learning resource here, go away and use it, and not providing the level of support. If there are issues that people then come across and have to face and have to deal with, you have to have that level of support. So whether it's a 24/7 helpline that people can contact or a counsellor that they can contact, it's very important to have that blend of both. And the comms thing and access to the internet is something I think we will debate forever. I think the internet is here, connectivity is here, and I think as people deal with it and have to work with it in their working lives now and on land, I think it's something that people at sea need to do. And so what Mark says is absolutely right. You know, people need to kind of make sure that they use it appropriately. So that's all for me. Thanks.
Okay, Stephanie, anything for you to add to that on e-learning and that?
It's been very interesting actually hearing the rest of the panel talking about this, and I think there's a lot of different perspectives on e-consultations and the effectiveness and access. I don't have a lot to add. I think it's a good resource to have. I do wonder whether some ship operators might have agreements with sort of consultation services that it may be good to speak to and get a perspective on how effective that is and what the uptake is. But without having that, I'm not really sure. I think having it as an option where people know they have anonymity and they're able to kind of get clinician access, it starts the conversation. So, you know, it starts them thinking, actually, I might need some help here. This is something that's been advertised to me. Let's give it a go and see what happens. So I think anywhere that people can get that type of support is beneficial.
Okay. Just one, I'm going to stay with you there, Stephanie. You spoke in your opening address, introduction, that it's important to check in. What examples of language terminology have you seen, heard, to actually improve that breaking down of that stigma about mental health?
That's a really interesting question, Stuart, and I don't think I've ever been asked it before. Terminology is really important, and also to an extent knowing a little bit about who you're asking and what their situation may be can be quite beneficial. I think there is no right or wrong answer to that. I think just making the contact and letting someone know that you are there for them, and sometimes taking a light touch is enough. Kind of just saying, how's your day been? You know, what's going on with you? I think potentially avoiding direct things like, are you okay? Because the likelihood is the question might just make someone think, well, no, I'm not really, but I don't really want to talk about it. So it's not encouraging as much open type communication. Or some people might see that as someone assuming that they're not okay, which can also put a barrier up. So I think just generally having a bit of chit chat every now and again, taking the time to get to know somebody that you're around, looking out for little signs and signals that their behaviour might not be quite the way you're used to, and being able to even distract them a little bit by, you know, asking them to join you at the table when you're having a meal, or, you know, come to a social room or whatever. I think just looking out for the people that you're around and not being afraid to ask, not being afraid to engage with those people, and potentially, depending on the situation, knowing when it's beyond you. So not taking on too much and saying, actually, I've opened this dialogue, might need somebody who's a bit more professional or a little bit more knowledgeable, and encourage that person you're talking to make the steps, maybe, even if you go with them, or you give them that information, just to take the next steps to get some support.
Thanks, Stephanie. Sam, same question.
Yeah, it's a difficult question, Stuart. Being the purser on board the vessel, lots of crew naturally gravitated towards me to come and share their stories with me. You have to refrain from being judgmental, and also, like Stephanie said, to try not to ask, are you okay? Because they can just say yes or no. Maybe ask them how their day has gone, or how is the situation back home, say in the Philippines or South Africa, and give them the floor to open up and to discuss more about what's going on for them. Sorry, I forgot what I was going to say. And when I was on board last year, I was on board for 7.5 months, I would always leave my cabin with like a smile, because it could in turn change somebody's day.
Yeah. Okay. Gordon, thanks for your comments on the Q&A. Yes, absolutely, completely agree with you. I did start the session by saying that my nephew did commit the act of suicide. So it is all around terminology and that side of things. The more and more people that actually realise how mental health affects different people in different ways, in different situations, and at different times, is absolutely critical. So breaking this stigma and breaking this conversation and using this right language is key. And it does start from the top of most organisations, because most people will take that lead from the CEO, from the managing director, from the captain of the ship, to say, this is how we deal with situations all the way across. That is exactly the reason why we're having this conversation, to actually get people to sit up and realise that there is perhaps a better way of talking to people in the right way, in a normal level conversation. Sandra, what do you think about language and terminology?
Yeah, I think language and terminology are very, very important. I think part of it is to do with education and how much people understand about mental health, and to not see kind of a difference between physical health and mental health issues that people have. Because unfortunately, there's always a little bit of discomfort when people talk about mental health problems. So, for example, when I've been talking to crew, if somebody hurt themselves, most people are very, easy to, if somebody sprained an ankle, to try and help them and sort out the issues that they may have. But if somebody has a mental health episode, then it becomes more of a problem. People don't really know how to talk about it, because they sometimes feel their own discomfort. And I think part of this, and to kind of get over this, is to kind of educate people, so that it's an ongoing conversation. And so the more people talk about it, the more comfortable people are about talking about it. And so if somebody does say, I'm having a really bad day, or life's awful, you don't just go, oh, that's a shame, and walk away. That people actually engage with it, and that the person asking is comfortable enough to do that. So that's why the kind of culture of care is important, because if you, and I'm sure yourself, when somebody says, how are you doing, and you say fine, or you say, well, actually I'm having a bad day, and they still carry on walking, that they don't really care. So it's making sure that in our culture of care, we are saying to people, if somebody says, actually I'm not having a good day, or this is awful, you stop, you listen, you take note. So I think it's really about an individual's education, educating that whole kind of crew and that culture, you know, where we stop, where we listen, where we take note of what's going on, and we spend time actually understanding why people have issues or what those issues may be. So I think, you know, I think it's a lot to do with about people's individual discomfort with issues as well, which may mean it's not easy for them to talk about it.
Okay, so I'm going to stay with you there, Sandra. You said people asking for help. Where do we send them? What can we offer them? How do we go about providing them with support and help?
Well, I think companies have those kind of e-learning things or e-programs and kind of 24/7 online support. But I think it may also be helpful for some of the kind of officers on board vessels to actually have some kind of very kind of basic training where they can kind of see something and then really importantly signpost it on to somebody who is qualified to handle that. I never want people to feel that they have to deal with that particular issue themselves and feel under pressure to deal with those kind of issues. But it's really important that they understand what level of ability they have and then signpost to professionals to help these people.
Okay. So Mark, language and terminology, asking for help, your crews, your boats, how do you deal with that situation?
Sorry, I'm on mute. We debated long and hard as to how we term this, whether we should say how it is and call it mental health, or whether we should use a more fluffy term of well-being or this or that. And we decided to stick with it because that's part of the openness and part of the courage that's needed to actually accept the fact that this is an issue which needs to be dealt with. So we've kept with the terminology mental health, and we've used it very openly and liberally in everything that we've done, so it destigmatizes the terminology. We have the confidential helpline, which allows staff and crew to have that crutch if they need it, and that is manned by qualified psychiatrists. One thing I was very careful not to do is, and this was a requirement in mental health support solutions, is that this is not, there are many well-meaning people in this world, and what I wanted to avoid, if we take the extreme, is some toughened Ukrainian master telling his, in thinking that he's doing the right thing, telling an individual within his crew or within another crew, come on, man up, get a grip of yourself, because I had that in the army, and that is, it can actually push people the wrong way. So, well, support is great, but it can go massively wrong, and these proper real mental health issues require professional help, not a shoulder to cry on, not how are you identifies maybe that there is an issue, but then take a step back immediately and involve professional help, because in thinking you're helping, you can push someone to extremes that you had no idea, because unless you've actually been there, you have no understanding of what this is about. So that was really important, and it must be anonymous. And it must be proactive as well. We're not just dealing with the symptoms here, we're dealing with the cause. So video education, frequently delivered to individuals' phones so they can download and educate themselves on how to deal with these issues, but also how to recognize it. Really, really important. And mental health support solutions run courses within our offices. So, our crewing department were and are under huge stresses. And we have run resilience courses, proactive resilience courses within those departments and others to preemptively deal with this before it happens. This is a science. It is not some fluffy wuffy area that you can deal with unprofessionally. You can't, and this is not an area for well-meaning people to put an arm around shoulders. Real mental health needs professionals and requires professional assistance at all stages, and you have to call it what it is. And people have to steel themselves. Resilience is as important as dealing with the symptoms, if not more important. So really hard terminology, and an open and transparent. And look, mental health, everyone on this panel, I would vouch that half of them have experienced mental health issues and have feel stressed and probably had a breakdown at some stage in their lives, or will have at some stage. If everyone is having an honest conversation, no one goes through life without having a serious mental health issue at some stage, be it a split up, be it an illness in the family, loss in the family, a divorce, stress at work, whatever, and manifests itself in various different ways. We will all have to be aware of this at some stage in our lives and deal with it. There's no doubt about it.
So that kind of leads us on to sort of one of the questions that Gordon has raised on the chat, and it's we need to first facilitate that conversation. So Mark, you've really sort of started that conversation going. I'm going to pass that over to either Sandra, Stephanie, or Sam. How do you think we need to facilitate that first conversation? Steph?
Yeah, Stuart, I think we also need to bear in mind that very often people are very afraid to say the wrong thing. They're not sure what the situation is. They don't know how someone might react. They don't know what that person's going through or the impact it might have on them. So, yeah, I think opening those conversations can be one of the hardest things, and partly breaking down the barriers is to try to persuade people or reassure people that actually often you're not going to say the wrong thing. If you say something, it's probably better than saying nothing, if that makes sense. And I think from where we're going with the ideas of sort of added awareness, resilience programs, e-learning, we're giving people a lot of information. We're giving them a lot of an idea of where we want them to go with it. But actually the practical application of that can be quite challenging as well. So I think having that, again, going back to that word holistic, having a holistic way to roll that out, to look at how those interactions are happening and how people are comfortable with them. The panel's also mentioned the benefits of having people on board, particularly in welfare type roles. Again, that kind of goes down to an extent the national culture roots and individual preferences roots, that it could be that even if you've got all of those things in place, we also have to appreciate there will be people that slip through the net, and that isn't a failing of our system. So I'm not sure if I've gone totally off what you asked me in the beginning, Stuart, but it's just things that have been going around my head, I think, over the last hour or so.
Yeah, no, that's fine. Absolutely fine. There is a question in the chat from Mark to Samantha. Not the professional help, but real experience on board. How do you feel that people are willing to listen to others whilst on board, and how much time staff on board are given to be able to listen and just be there?
For myself personally, when others come to approach me, maybe I could be sat at the desk, but I might have an office full of people, so they don't feel that they can approach the conversation and talk. So it's possible that maybe after we've finished work, I will ask them to come maybe in my cabin to be able to talk there openly and honestly, and with nobody around listening into the conversation. You have to keep a good balance with that though, because obviously the cabin is my area to go and to hide away from the rest of the boat and to rejuvenate, sleep, rest, and have time for myself. If I'm constantly bringing crew in there to disclose their worries or struggles that they may be going, then maybe this for me will turn into a space where it's not for my own personal well-being and rest. It would become more of a helpline place. I mean, sometimes, as I say, people, they don't think that they can reach out to maybe their heads of department because they think it's going down too much of a formal route, and they think that maybe that they may be judged for what they've said, or they may lose their job, and they get worried about the views of other people. So I think that, as I said personally, for me, when during the beginning of the year where I trained to be the mental health first aider, it allowed me to recognise things not only that had happened within myself, but also within other crew members. And was very fortunate last year that we had a doctor on board with us. So if I felt that the pressures of other crew approaching me with conversation was getting maybe a little bit too much for me to handle alone, I would quiet and confidentially speak with the doctor, so that I knew that I had support, and to try to encourage the crew members to take that first step to ask the doctor for help confidential.
Okay, thanks, Sam. Thank you very much. Just from a professional support side of things, just telling you from my own organisation what we do. So we've got counsellors, we have therapists, because there is this massive gap between somebody saying I've got a problem and then the professional support from the NHS or anybody else like that. There's a big gap at the moment of around 8 to 10 weeks. So we as an organisation, very similar to Mark, has plugged that gap and allowed people to have the counselling that they may need, the sessions with a counsellor. We even have hypnotherapists now working with us. We're trialling hypnotherapy with certain situations and certain aspects of mental health and health issues to see if we can actually get on top of that. So if somebody's saying, I can't go into confined spaces, we're using hypnotherapy to see if that actually alleviates the problem and that side of things. So that is everybody still having some sort of mental health issue where it's preventing them actively doing their job in the day-to-day arena. We've spoken a little bit about resilience and that side of things. Let's touch a little bit more on resilience. Mark, you've mentioned people have to be more resilient, people need training in resilience. What do you mean by that?
I think much of resilience is understanding. And, I think people of my generation have as much to fear from a lack of understanding of technology and the way of things as from mental health issues. I remember even as close as sort of 3 years ago when I heard that my daughter was anxious and wanting some support in dealing with her anxiety. And I was pretty tough on her, to be honest with you. I said, well, look, what does anxious mean? You're shy. I was shy at her age, late teens, early 20s. We we didn't deal with the things in the way that we do now, and anxiety was just not known about. It just wasn't a word. You were shy. If you went red, you were embarrassed and you were shy, and that was the end of it. Anxiety is a huge problem. And as a society now, not just because of COVID, but you know, for the last, I would say, 5 to 10 years, we're much more aware of these issues, and much more aware that they need professional help, and that someone's not wet or pathetic or weaker simply because he or she has certain mental health issues or has had to deal with certain mental health issues. And you know, I think it's beholden upon all of us, whether you're in a leadership position or not, to get familiar with these issues. And if you're not being provided education within your organization or on board your vessel, then to self-educate yourself on them, because otherwise you're a Neanderthal. You know, it's as important to be aware of these issues as it is to be aware of how to use your computer and the various facilities there. So resilience, I think, is in large part awareness and making yourself aware, and then being taught when you start experiencing feelings of how to deal with those, whether it's simply get more sleep, drink more water, discuss more, have more fun, read, switch off your computers, discipline yourself, switch off, get fit, eat more healthy. You know, this is all resilience training. And you know, it's pretty basic stuff. It's not rocket science, but it's stuff that we, in the past, I would say, oh, the guy's you know, he's wet, he's flaky, or he's this or he's that. That's because I come from that generation that it was perceived as a weakness. It's not now, and I'm weak if I don't get on top of it and recognize it and provide for it in my staff. And when staff do slip up and give a cry for help to me or through the confidential, that we don't provide all the support that we possibly can to get them back. They're not a written off or a weakened or in some way flawed individual or asset. Far from it. They will come out stronger. Because if you go through one of these things, having gone through something like this myself years back, 30 years back, I'm far more in tune with what I can take and what I know about myself than 3/4 of the people out there. So it's part of a learning process, and it's not a weakness, it's a strength, because you actually learn about yourself and how to deal with situations in a much better way. So resilience is, I think, first and foremost, an awareness and an education. And secondly, a recognition and how you deal with these issues. And self-help, small little steps, can go a very, very long way.
Okay. Stephanie, what do you believe?
Yeah, I think we've got to be very clear about what we mean by resilience and resilience programs. And there's some really good ones out there. I think giving people the tools to recognize when they're not okay, when someone else around them isn't okay. It also fits into the wider resilience of a resilient organization. So, you know, it really does go through the levels. And I think I've just seen in the chat, there was a comment around sort of the terminology with resilience and not being a man up kind of terminology. We need to recognize that however we do this in our industry, there will still be pockets that still have that type of mentality, and it is a blocker in terms of the stigma at the moment. It's an old industry, it's a traditional industry. Change takes a very long time and quite a lot of investment. And don't get me wrong, we are getting there, but there will be elements where, even if they're not obvious and people don't do it on purpose, they may say, oh, that person's going through a bit, I won't give them that task, or, you know, I won't ask them to do that, or I probably won't put them through for promotion because they really struggle with stress and various things. So I think no matter what we're doing to take the steps forward, we also have to bear in mind the things that we're up against, and the fact that just because somebody is going through a difficult time doesn't mean that they will have an ongoing barrier to achieving what they need to achieve. They may just need a little bit of different support. And for those that may be struggling more, the resilience message might be harder for them to carry. So they may feel like, oh, well, I'm not really being resilient because I'm failing. I'm not managing to be okay. So I think it is, again, around how we market these things, how we really promote the benefit of them and tie them into the wider culture of care.
Okay, thank you. Samantha, do you have anything to add on that one?
I think that it's not all about like building resilience. I've been being seafarer for over 10 years, being at sea. I think I have a high resilience. Like, you know, we often put in situations where we have to adapt to change. We have to change our thought process. We have to, if things are changing within the industry, we have to move forward, you know, and take on the change of the company. Would I think that I felt like I was a really resilient person, but having the effects of the situation I was faced with on board, plus the pandemic and the sheer extra duties that it made for my job, that made me become extremely fatigued and close to burnout. And then in the end, leaving my vessel because I felt like the best thing for me was to take some time out. And then I'm saying I'm really a resilient person. So it's not all about building resilience and then that mental health struggles won't come to you, because it is equally the situations that you're facing that, as we've said in this conversation before, that it's not just what you're dealing with, it's the situations that make those rear their head.
Okay. One final question for the panel. We're talking about breaking the stigma. We've all probably got documents from our own organisations that say we have a mental health policy and we want to have open, frank conversations in a safe environment that give people the warmth and comfort to be able to come to us and have that conversation about mental health. How do we make it a reality? Sam?
Throw me in the deep end. As I say, it's really difficult. I think somebody mentioned also in the chat that there's lots of organisations that they're saying, that they're trying to promote that they're more mental health awareness, and we have lots of notice boards on board for the crew to be able to read with helplines and things on. It's just sometimes it's not enough, I guess that I think personally, the more of us that stand up and are able to talk openly and honestly about our own situations and struggles, that it might encourage more people to be able to talk about their own.
Okay, Stephanie.
I think it's really, really positive that there's more mental health policies actually out there, because there was a lot of health and safety policy. I think, psychological side and mental health was rolled into that, but not very obviously. So it's a good step. It's a great step. I think we've seen that there's a lot of programs out there that are working to raise the awareness level. There are more open conversations, I think, taking place. But people need to know, I think that things are still moving in the right direction. I think just putting a policy in place and saying, doors open, just come and talk to me, you're right. It's probably not quite enough, but actually seeing where there's action. So potentially the learning from experience kind of approach, where you say, these people have sought support. You don't have to disclose what it was for, but putting out statistics potentially if you've got a helpline, what is the level of engagement with that helpline? What changes are planned for it? You know, where people have gone through to becoming wellbeing champions, you know, getting a day in the life of a wellbeing champion. What is rewarding to them about the role that they're playing, you know, and seeing it from the other perspective of people who are passionate about helping. So you kind of raise that profile, you see how the actual measures in place are being successful or used. I think there is more that can be done.
Okay. Mark?
I think, look, like many things, you need buy-in, and communication, continual dialogue is certainly one way. We are embarking on a diversity and inclusion and also sustainability campaign for the second half of this year, or have been, and we could have no doubt ticked the diversity inclusion box or the sustainability box from beginning of July. There's no doubt we warrant that ticking, but I wanted us to really get everyone's engagement and buy-in. So, you know, really celebrate diversity, celebrate the wonderful attributes that diversity in all its forms bring to our organization, to really understand that, and ditto with sustainability, so that when we tick the box at the end of this year to an ongoing program, everybody is the wiser for it and everybody really understands and buy in. So too with mental health. I think, you know, we have to get buy-in, and it has to be fun, and we have to celebrate mental health in the same way that we celebrate diversity. We're all very, very different. We all have our various resiliences or weaknesses as well. And that's what makes us special and makes us different. And if we see that and if we understand it, we can strengthen ourselves in certain areas, then we come out as better individuals. So make this fun, make this talked about. Get rid of the stigma and see it rather as a strength. Just turn the glasses around and get everybody talking about it and buying in, and you won't have a problem. It's not a problem, it's a challenge, and a challenge is there to be overcome, and it's all about dialogue and communication.
Okay, thank you. Sandra, so the question was, how do we get our mental health policies that we have into reality and have those open conversations and break the stigma?
As I said, I don't believe this is something we can do overnight. It takes a long time for this to, and a good process for this to go in and become a kind of fixed part of an organization. So for me, it's about making sure that you have the right comms plans in place, that people are kind of all speaking and giving the same message, and that actually those values and the things that you're talking about become evident in everything that the organization does, because you just need one organization, or one question or one manager to kind of make a mistake, and then all of those people who kind of come under that management will see it as a negative thing. So I think it's about making sure those comms are in place, that management teams know exactly what the kind of key messaging is about, and that you get buy-in right across the organisation.
Okay, thank you, Sandra. So I'm going to draw the conversation to a close there. We've heard the panel provide some really good insights into their own organisations, their own thoughts, their own experiences on how we break down stigma using practical examples and what organisations are trying to do. I think we can all safely say that we are starting to broaden the agenda when we're looking at mental health to more of a holistic support approach. Going through, is the person working effectively through fitness, diet? Are we caring about their symptoms? Are we looking at them as an individual? Are we looking at ourselves and what we can do and provide support to our individuals? I think we've also started to look at post-COVID that people are key to any of our businesses, not an expenditure. And I think as soon as we've done that, I think we can now start to ask how can we help, and get that language, terminology, and more awareness around resilience. That's something certainly I will be taking back and looking back to see if the more wider mental health group can shed some light on what other organisations are doing, so that we can actually share best practice right the way across the sector. I'm going to hand you over to, before I hand you over to Chrissie, I'd like to thank all of the panellists for their time and contribution today. Thank you very much. It has been appreciated very much. Chrissie.
Thanks, Stuart.
Thank you.
Wonderful. Again, reiterate my big thank you to all the panel, to Mark, to Stephanie, to Samantha, to Sandra, and Stuart for chairing today's dialogue. We really hope to everyone in the panel, this has been a useful session. As we have said, this session is being recorded and we will be sharing this. I've certainly been taking lots of notes throughout the panel session, and I really do thank you again to the panel for your honesty and your passion. We have got our next mental health network, which is being held next Wednesday, the 22nd of September at 2 p.m. We will be discussing nutrition, diet and fitness, in a continued discussion around menopause and menopause policies and the impact of women and men's mental health around menopause. I would also like to say a big thank you again to Lloyd's Register for sponsoring today's event, and to Aberdeen Harbour Board and Centreline for their support of the Diversity in Maritime programme. Again, one final huge thank you to the panel. We will share this recording. We're now going to draw the session to a close. Thank you so much. Stay safe, stay well, and we hope to see you all soon.
Thank you.
Bye.